Okay, everybody, welcome to the Healthy Joints, Healthy Lifestyle Show. And for those who don't know me, my name is Dr. Arinola Dada. I'm a rheumatologist. I help people with joint pain become pain-free and people with autoimmune diseases get their immune system back on track. And today we have an amazing guest who is a wonderful friend of mine. Her name is Dr. Toyosi Onwuemene, and she is a hematologist. She is a professor of medicine and hematology at Duke University. And I am going to let Dr. Toyosi introduce herself to the guest and tell us why she does. And this is her second interview. So watch the first one, which was really good because we were talking about people who may be getting their knee replacement done and how to prevent blood clots. That's what we talked about last time. So this time we have a very interesting topic. But I'm going to let Dr. Toyosi introduce herself.
Dr. Dada, thank you so much for having me on the show. It is such a pleasure to be here the second time. Yes, I am Dr. Toyosi Onwuemene. I'm a hematologist. That means I'm a blood diseases doctor, and I specialize in all types of blood diseases that are not cancerous. So sickle cell, blood clotting, bleeding disorders, anything really that has to do with red cells, white cells, platelets, the blood. I'm the doctor for that. So I'm excited to be here because today we're talking about the importance of clinical trials and particularly some new and exciting information about sickle cell.
Thank you so much. Yeah, so, we're going to talk about sickle cell, and I was telling Dr. Toyosi just before we started that that world is totally separate from what I do. I had a personal story, a friend of mine, I lost a friend to sickle cell disease, and it was very interesting to hear just the groundbreaking changes in the world of sickle cell disease. And so I was like, I got to talk to Dr. Toyosi. I need to get up to speed. But I think more for also our audience is just kind of wrapping our minds around just how amazing the clinical trial results we're getting these days. And so how important it is for people to participate so that we can actually get these life-changing, life-altering outcomes. So Dr. Toyosi, tell me kind of from your standpoint, why should people participate in clinical trials? And then we'll delve into sickle cell.
Wow, great question. And to be honest, I want to talk about it in the context of sickle cell disease. Now, I will tell you that sickle cell disease is one of the very first genetic disorders that was discovered in the early 1980s. Very first genetic disorder, still no curative therapy. It's only in the last few years of clinical trials really moving forward that we've gotten to the point of these groundbreaking news about gene therapy for sickle cell disease. It's such a big deal. We knew about the genes in the 1980s, but we're just now 40 years later actually having therapies that might help to address the genes as a strategy. And so this happened because of partnership between patients and providers, because in order to do clinical trials, we need the industry to come together with physicians, but most importantly, we need patients who have the disorder to step up and say, I want to have access to these groundbreaking therapies as part of a clinical trial. I want to be part of the vanguard, the group of people who help to figure out whether this is the right therapy for people with this disease. So clinical trials are so awesome because they represent partnerships between industry, physicians, healthcare providers, and patients. And I think it's one of the biggest opportunities for patients to actually be participants in moving healthcare forward.
I think that's so well said. I have nothing to add to that. I think that really summarizes, why we need to do that, because I know people think about, oh, am I going to be a lab rat? But I think for us to really get cures to it, and in my world, we don't have cures for a lot of things, right? And for us to get to cures, which is what everybody asks me when they come, they're like, is there a cure? Like an antibiotic, when is it done? And a lot of times I'm saying, no, we can control, manage, prevent deterioration, but we're still struggling to get cures, and we need the community to participate so we can get there. Okay, we're going to dial back. So what is sickle cell disease, Doc? What is it?
Yeah, so really great question. So sickle cell disease is a genetic disorder. That means the primary problem is a mutation in a gene that produces hemoglobin. Hemoglobin is the molecule that's responsible for helping get oxygen delivered to our tissues. So because there's this problem, because there's this mutation in the beta globin gene of hemoglobin, hemoglobin doesn't work like it's supposed to. So red blood cells are important because they deliver oxygen to the smallest parts of the body, actually to all of the body, but they do this by squeezing through the smallest blood vessels. So they need to be what we call deformable. That means flexible and able to squeeze through things. Well, this mutation causes the red cells to become brittle and stiff. That means when they're trying to squeeze through to deliver oxygen, they're so brittle they break apart and they can't get oxygen to the tissues that need them the most. The problem is that when tissues don't get oxygen, they start to die off. It's what we call ischemia, and you can feel it as pain. Whenever tissue starts to die off, you feel it as pain. So one of the biggest and most important components of sickle cell disease presentation is acute crises, so acute episodes of pain, but then also chronic pain as these episodes compound on each other. And then there's damage to these tissues, right? So it's not just the pain, but it's also the damage. And so there's chronic organ damage that occurs over a lifetime of sickle cell disease that affects the brain, the kidneys, the heart, the liver, the bones, the eyes. It really affects every part of the body. So sickle cell disease, wow, it's a very important disease, and certainly one that we should be thinking very carefully about.
So we understand what it is and some of the symptoms that people are having. Who's typically affected?
Yeah, that's a great question. So sickle cell disease, because it's a genetic disorder, it's passed on from parents. And so what you do need, it's a disease that has to come, you have to have both mom and dad have have a trait or have the disorder to pass it on to the child. So it's what we call a recessive inheritance, right? You got to have both copies of the genes to have disease. If you have one copy, then you just have trait. And so anybody can actually get it. In general, we tend to think about people who are originally from Africa, originally also from the Mediterranean areas. And so in general, we think of it as a disease that affects really African Americans in the US, but it can affect people who are not people of color as well. And so in general, though, people from kind of the Mediterranean area and then people who are of African descent, but it can affect people across all races. It affects people from an early age. So really affects people of all ages.
Yeah, yeah. And we're becoming a potpourri of a society now, right?
Yes. Yes. And so I think one of the things I want to emphasize is that people don't think, well, this person's not Black, they can't have sickle cell disease. And that would be a wrong assumption. We certainly have patients that we care for who are not Black and have sickle cell disease.
Okay. So tell us, we kind of touched a little bit about gene therapy for sickle cell disease. How does that work? What is that?
Oh, yeah. Really great question. I want to take a step back and just talk about sickle cell disease therapy. So when we first started, what we really wanted to do was how do we help people just manage through their disease? And so many of the disease, the therapies that we did early on was just to kind of manage pain, manage the chronic organ damage. And over time, we were able to develop therapies, for example, hydroxyurea, that actually was able to modify the disease a little bit, but not cure it. And then we've actually had approvals of other drugs that have been able to modify the disease such that the hemoglobin is a little bit better. People have a fewer crises, but we've never really been able to cure the disease until stem cell transplant. And so one strategy before gene therapy that was curative is the stem cell transplant. And for many patients, they needed to be able to either have a matched sibling or they needed to be able to have a match within like the general donor population. And that is not always accessible to people. Now, gene therapy is a new curative therapy that was really just approved in December 2023, January 2024, we had two gene therapies approved. And what they strive to do is to address the gene problem. So there are three kinds of ways that we can do gene therapy. These particular therapies work in two ways. So one is by addition, so gene addition. You add a gene that promotes the development of normal hemoglobin, or you edit the gene so that you promote the production of fetal hemoglobin. That's hemoglobin that actually is somewhat protective against the effects of sickle cell disease.
Okay.
Now, that's what happens. So you have to take the cells out of the body.
Yeah.
And so this happens when patients kind of like, they go through a procedure called leukapheresis, where
Okay.
they remove stem cells, and then
Yeah.
they take these stem cells to the lab. And this is
Okay.
very, 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 very high-tech lab, not just
Yeah.
any lab. And
Yeah.
they're able to do the editing or the addition in the lab. And then you bring the cells back into the patient through a stem cell transplant type of scenario, where you
Okay.
first of all prepare the person to receive the stem cells,
Yeah.
and then you give them the infusion of the stem cells as well. So it is a whole process.
Wow. So, but how long do stem cells last, or how long does the therapy last, right? Is that something that's now repeated in cycles? How does that work?
That's a really great question. So what we're doing is we're taking stem cells, and stem cells really are they're like the mothership of the cells that are
Mothership.
produced in the
Yeah.
body. We're modifying the stem cells. And so stem cells are what we call, they live a long time, right? They don't die. And so
Okay.
once we modify the stem cells, we expect that the
And
stem
you're
cells
good.
actually stay modified. Now,
I
in
think
the
that's
clinical
so true.
trials that led to the approval of these therapies,
Mhm.
patients had significant improvement in their vaso-occlusive crises, and most patients have continued to do well beyond
Wow.
the clinical trials. So I think we need years worth of data to really
Yeah.
say how patients do long term, but because we're modifying stem cells, we expect that these therapies are going to last long term.
Wow. That's amazing. That sounds like a cure.
It is a cure. It is
Isn't
curative
that
therapy.
something? Wow. Okay.
Yes.
I'm just kind of, yeah, I actually didn't realize that.
It is.
So that's, yeah,
It's a
that's,
big deal. It is a big
yeah,
deal. And I mean, one
wow.
of the biggest pieces of news that has come
Breakthrough.
to sickle
That should
cell
be all over
disease in the last.
CNN and all over everywhere. It should be, right? Yeah.
Yes. Yes. It's
That is a
exciting
big,
news.
yeah. So, because I remember kids having bone crisis, right? Having bone pain because, the red blood cells sickled and then there's no oxygen, just like you said. And then it
Yeah.
manifests as pain because things are dying. Wow. Okay. So, I think we talked a little bit about why people should participate in clinical trials, but I think this is a clear example, right? On how we need those partnerships. What you said.
Absolutely. Absolutely. I think, the reason why we're always having to encourage people is because, historically in the US, we haven't always behaved well when it comes to clinical trials, and patients haven't always had a voice. And sometimes in the past, right, patients have had things done without their consent. We know the story of Henrietta Lacks, and that's, the Tuskegee experiment. So there's a lot of distrust and mistrust that
Strong.
sometimes leads people to say, I don't want any experimentation, please.
Yeah.
I you know like our history as Americans, we've come a long way, and we
Yeah.
continue to improve, and many of these challenging situations have led to the innovations that allow us to do clinical trials in a way that respects the patient's autonomy, solicits and invites their participation throughout the process, and so that patients really should feel confident that they are partners in the process. And really, without patients participating, no major therapies can move forward. And so it's an important partnership. And unless patients come on board, it doesn't happen. So absolutely critical.
Absolutely. Wow. Okay. Can you tell us a story of a patient? Because you are a phenomenal doctor, Dr. Toyosi. Can you tell us a story of a patient who's had an amazing outcome or benefit from kind of being in your care? And you can make this
Yeah,
general.
sure,
I know
sure.
there are lots of stories, lots
Oh,
of
so
good
many
outcomes.
stories. I want to say that, when you see patients experience the severe pain crises associated with sickle cell disease, it's traumatic. And one of the challenges as physicians of taking care of patients with sickle cell disease is that you sometimes can't really help address the pain that patients are going. I mean, we work hard towards it, but sometimes it's challenging. It's challenging for the
Yeah.
patients, it's challenging for providers. And so, I haven't had any patient yet undergo gene therapy, but one patient recently actually was a young child who underwent, and this is someone I know, not because I'm not a pediatric provider, this is someone else kind of peripherally involved in their care, but this is a person who underwent stem cell transplant. And so, and it's a curative therapy. And because the stem cell transplant really occurred when this person was younger, they really, really did well. And now they're in a place where they're not having pain crises anymore. They continue to have visits to the doctor. They're continuing to do well. And it's such a big deal to say, wow, somebody who was in pain all the time now has very little pain and is not taking as many of these medicines to try to address the pain as possible. So it's really an amazing thing to see, and really important, especially as early as possible, getting these therapies on board, because the lifetime of organ damage with gene therapy actually cannot be reversed. So while the disease can be cured, whatever damage has happened is already happened. And so I think it's important for people early on to start to have these conversations with their providers to say, hey, talk to me about gene therapy. Am I a candidate for gene therapy? How can I start to think about incorporating this therapy into my care? And so it's this is such great news. It's complicated, right? It's not so straightforward. There's a whole process to getting the therapy, but wow, what an opportunity for people to do better. Yeah.
What an opportunity. Wow. Wow. Dr. Toyosi, it is always wonderful to have you on the show. Thank you
Always
so
a
much.
pleasure to
And you
be
are
here.
she is the most brilliant doc that I know. She actually is just phenomenal. So, Dr. Toyosi, I know that you wear many hats, right? So tell us about kind of your different hats and how people can work with you.
Absolutely. Thank you for asking. So I am a clinical researcher, and research is so important. And there's so many different types of clinical trials and so many types of clinical research that people do. But, as I talked about, it's a partnership between patients, their providers, the industry. And so what we don't have as much of is providers who are involved in research. And for many patients, they want to participate in clinical trials, but they look at their doc and they're like, but you don't look like me. Can I trust you? And so we need more physicians who look like our patients that we serve involved in research. But many times physicians are overwhelmed. They don't even know the first way to start and be participating in clinical trials, much less talking about leading clinical trials. And so I support clinicians who want to be able to lead clinical trials, who want to be able to be active in research and scholarship. I help them make that transition so that they can do it successfully. It's an important thing because we need physicians involved in research, and I'm excited to be able to bring on a generation of physicians to be able to do that.
Wow. Thank you, Dr. Toyosi. That's what's called making an impact. So what about social media? How can people reach you, find you?
Oh, absolutely. You can find me on all social media. The best place to reach me is on LinkedIn, Toyosi.Onwuemene. I'm also on Instagram as Coag Coach, and I'm on Facebook as well. So please reach out to me. Happy to hear from you. If you want to share a story of your experience in receiving gene therapy for sickle cell, or you want to find out more about how to become a clinician scientist if you're already a clinician, I'm happy to help.
Wonderful. Well, thank you everybody for listening. Thank you, Dr. Toyosi, for coming on the show. So we're going to have the links to Dr. Toyosi's social media at the end of this, the links to the bottom of this show. If this has been helpful or you think it's going to be helpful to anybody, like it, subscribe to our channel, and share it. Thank you so much, everybody, for listening. Have a wonderful day.